Welcome back
Welcome,
to
Carly.
Fielding Dental Healthcare's podcast on things that you never knew you wanted to know about.
Oh, wonderful. All things dental.
So you're a mom.
Yes, I am a mom.
And
We don't have to pretend that.
You have two wonderful children.
I do.
Who are just the most well-behaved little
They
angels.
They just, yeah.
Pretend you're not fielding dental. What are you looking for in a dental practice?
I definitely want to look for somewhere that my kids are going to feel comfortable.
Right.
Because if I walk in and my kids do not want to enter the building,
Right.
they don't want to go past reception.
Yeah.
They don't want to go into the room.
Yeah.
All those little barriers, I just want the ease of getting them in there,
Right.
having them lay down and feel comfortable so that it's just an easy appointment.
And I think knowing kids are going to be kids, you want to find a place that is going to welcome that kind of energy.
Yes.
Like, we're not talking, there are some children that I wonder if I could get a book from their parent on how they were raised because they are wonderfully behaved. But we all
Those aren't my kids.
And also, walking into a dentist office is already nerve-wracking enough. So most of the time, your kid might be a little nervous or distracted. So welcoming that type of vibe from the child is important, something that we always take into consideration. Keep in mind, they're coming from school. They're coming from soccer. They're coming in between soccer and basketball.
All
and they have
levels
half
of
an
energy.
hour to get it all in.
Yeah.
So I do agree. You want to find somewhere that your kids are going to feel comfortable, but also as a parent, you want to make sure you feel comfortable so you don't feel silly asking the questions that you want to ask, or maybe sometimes being prompted in advance on the things that when you have a kid, you don't necessarily know what's coming your way.
No. Yeah.
So,
definitely a lot of surprises.
and dental is one of those things that there are certain things that happen at certain stages. So as a hygienist, what are the things that you're thinking a parent's going to want in that hygiene operatory for their family?
Certainly friendly hygienist. You don't want to walk in and think, oh my goodness, this is the drill sergeant. This is not going to go well. A friendly vibe. We certainly cater to all levels of attention spans. So if we need
That's a good one. That's a good one.
have you lay back and hopefully have you focus on the TV for a moment so we can get you to sit still for just a second
Yeah.
while we look inside your mouth. We have that. We have our kids suite where we can educate our children
Yeah.
on certain oral habits, things at home to make it a little more fun when we're
Yeah.
thinking about dental, because let's face it, dental is not really that much fun when it comes to kids' activities and brushing and flossing. So we try to make it a little more fun. And we also have those fun glasses.
Right.
So a lot of times for kids walking in, it can be very overwhelming. And if they could put on like a cool pair of sunglasses and they feel like, okay, I'm like a superhero right now walking into this operatory,
Right.
and I, feel really good about this experience.
Yeah.
You know that the appointment's going to go a lot better,
Yeah.
at least
No.
for your child and certainly for yourself.
No, for sure. And I think that kids' education room, to me, I feel like everything is so quick for families that we're watching and listening. And a lot of times we'll tell them something and it just goes right over their head because they're also nervous about how is their kid feeling? What is the hygienist thinking of
Why
the
are they
mouth?
not sitting
What is
still?
the jealousy or not jealousy? What is the judgment of how that child's mouth has shown up? And
Yes.
I think that by doing the Kid Suite, we're trying to peel out a little bit of what we're trying to accomplish in a really rushed appointment and help the parent teach the kid and show them different behaviors that can help them with brushing, flossing, and remove the part that's intimidating, like when they're going into your mouth with sharp instruments and things like that. You don't know what's going on, what's going in my mouth. Take that aside. Make that an appointment that it needs to be. But then I think by doing the Kid Suite, we've tried to give an opportunity for people to have communication
Yeah.
and ask us the questions that they need to ask and not feel like they're, having to also behave for an appointment.
Yeah, and many times we've actually had some patients come in with their children, and the first few appointments are actually just friendly visits because we don't want to overwhelm the child.
Right.
We know that this is setting a foundation for many years to come.
Right.
And if they start feeling insecure, scared of that experience, every subsequent appointment is just going to be just
The feeling will start
Building
from the
on.
moment they walk in the door,
Yes.
as opposed to helping them feel like, oh, I like this place.
Yeah, this is
Yeah.
fine. This is comfortable.
Yeah.
I can do this. I'm confident. That's what we try to build.
What tools or what games do you guys have?
We try to cater to all different ages.
Yes.
One of the things that we have that was super important to us was the arcade games.
Right.
As soon as you walk
We're
in.
going to trick them as soon as they
Yeah.
walk in that door.
This is game
You are going to
fun.
have fun. And you're right. It's
Yeah.
kind of like an easy way for them to get
Wait a
used to
second,
the environment, feel like, this is fun.
Maybe I'm
This
not
is
going to the
easy.
dentist. wait a second, Mom. You said the dentist, but now I'm playing arcades. They're kind of tricked there.
But I do think like that fear of the dentist, that
Yeah.
it actually is fun. And you keep saying like, oh, it's not fun. It is fun. A lot of our kid patients
Yeah.
love coming to see us. And there aren't uncomfortable moments in the hygiene. Like, yeah, sometimes when you're trying to get that x-ray and use that sensor and the mouth's small and, that doesn't feel the most comfortable, but it can be fun. And if they walk in and they're tricked into,
Tricked.
if they walk
It's all
in,
about fooling the kids.
yeah, if they walk in and they see a cue,
Yes.
like, we want you to have fun.
Yeah.
We want you, this is okay. You can be a kid.
Yes.
And then when you transfer into the operatory,
Yes.
they would probably take a little bit more of that emotion in rather than the fear.
Of course.
And then
Yep.
you're saying, which I think we find a lot of times, we do recommend starting to bring the kids in
At a young age.
one,
Yeah.
or when you first see the teeth. And a lot of that is communicating with the parent and knowing what's coming
Mm-hmm.
and getting ahead of something, like on the rare occurrence that there is something to be watching starting early. We can catch it early. That's everything we try to do is be
Preventative.
preventative.
Yep.
But if they're coming from 1 and then they
Yep.
come back again at 2,
Healthy
and they're
habits.
coming consistent and they feel like, oh, this is a fun place. Of course, it gets a little tricky when we get into the zone that there is a cavity and we have to have one of those appointments. But hopefully we've had a couple positive ones before that. And, kids are kids. There's going to be different reactions and responses to the environment. And when we do have to do something, I feel like that's a podcast all in itself.
Yeah.
When your kid has to come and have a cavity and how you can help that be a successful visit. But
And also going back to that, the whole when they do have a cavity, or if there are some spots that we mentioned that they might be missing when they're brushing, flossing.
Right.
Just also going back to there's no judgment. There's
Yes.
absolutely
Yes.
no judgment on
That's
the
a big
clinical
deal.
side.
Yeah. It's a thing. I feel like I'm going to be judged coming in
Yeah.
with my kids because I should know better or I should be, but I do love our team for that reason
Yeah.
because we are all parents.
Yeah, we're all
And they
families.
really get that point that like nobody's perfect.
Right.
And it's really important to remove that level of fear of being judged as a parent, as a child, as whatever it is in the family dynamic. It's not.
There are so many different risk factors, like reasons why we would get a cavity and why we build up plaque. That there's definitely no judgment as to what the child or the parent has done.
Right. And that's important for our team to also share with the
Yeah.
patient so that they know that we're not judging them. So the whole point is you're looking for a family dental home.
Right.
And we've talked a lot about kids.
Yeah.
But it does stem beyond the younger age. Of course, that's the hardest one to win over. Those are the ones that we are forming what to think about dentistry. So we're doing a lot of stuff for that. But then there is also, when you do get into that teenage age range, if a child is in their 20s or if somebody is in their 30s, 40s, whatever it is, I think that if you find somewhere that has been operating on a certain level philosophically for so long, if you look at what we've done, we have so much advantage of time. We've learned so many things over the years and we're constantly learning every day. But having the experience that somebody might have in all of those age categories is huge for a family.
Yep.
Yeah, you gonna help me out here or are you just gonna say, yeah? Like, for example, when, teenagers,
Yes. Well, it honestly goes back to that we are a family practice. We are a family, and you have teenagers. You know exactly what they're going through. You know exactly what they're thinking.
Right.
I feel like every day we all live our different lives, but we all have these values when it comes to dentistry,
Right.
and we're constantly trying to learn and see new technologies and bring them into our practice,
Right.
so that we can continue to create that level of experience that we value in our dentist and our
Yeah.
practice.
Right. It's a level of experience that patients don't even know they need, but
Yeah.
it's there.
Yeah, because
Yeah,
we
both
want it as well. Like
From
we
the
want it for our
clinical
kids.
experience, so there's that, but there's also the experience of having the kids and
Mm-hmm.
knowing what it's like to bring your kid in for the cavity or bring your teenager in and be like, we lost our retainers 8 weeks ago and we never
Yeah.
called.
Yeah.
Or even like the frustration that you have with your kid when they come in and you know that they aren't doing what they're supposed to be doing and
Yeah.
you are going down that route of having cavities. I think it also, when you're the one who is going through potentially different phases of life where your mouth changes, right? There's certain things that can happen that, you know, like if a woman's having a baby, a lot of things can change. You would know more clinically what I'm talking about.
I'm just going to
Oral
let you keep going with
microbiome.
this. Well, I
and-
did want to touch on that point for the whole family. Something that we brought into the practice, which is like helps at all ages, is the guided biofilm therapy.
Right.
So those airflow units make all appointments that much more gentler on your gums, your teeth.
Right.
So when it comes to kids, teenagers, young adults, and then also, as you get older, this guided biofilm therapy is going to gently remove that sticky plaque bacteria from on your teeth and in your gums,
Right.
and make all of your visits that much more enjoyable.
Yeah. So like a kid who is in Invisalign or does have
Yep.
braces, easier clean.
Yeah. If you have a lingual wire, if you have a
right.
bridge, if you have a crown, if you have
Right.
an implant.
As things start to
If you have a
happen.
mixed dentition, so you have some baby teeth with older teeth and a lot of overlap and just very difficult areas to clean, we have a tool now in all of our operatories to very easily clean that.
Right.
It's amazing.
Yeah. Does it hurt?
It does not hurt at all. It is so gentle on your gums. A lot of times when I do have patients come into the operatory and they're a little nervous as to this new technology, a lot of kids mainly, but I would use the tool on their hands.
Right.
Actually, when we just did our school presentation,
Yep.
we had lots of kids coming through, and I did just that. I said, put your hand out and let me use this tool on your skin. And they could barely feel it. Just feels like a nice rinse of water.
Yeah. No, that
The
is a
kids
cool
love
tool
it.
to bring in. And you're right. We're taking into consideration all of the ages. This
Yes.
is not something that's just going to work for the young or the old. It's working for everyone and taking the best care of their teeth.
It's a great family practice.
Okay, so you're
So
looking for your dental practice. You want to find, I'll tell you, something where you can go and you're not going to get sent to 5 other places. And we do
Right.
take a lot of consideration into making sure that we're staying updated, we're learning the new things available and helping. Like we didn't
The umbrella
do,
of treatment that we do
yeah,
here.
we didn't do any teeth straightening until patients were like, I really just want to get it done here.
Yeah.
And I don't want to have to go somewhere else. So that's an important piece. The crowns, the implants.
It's going to be hard to get her to stop. Sorry, Louise.
Like the situation that we were talking before.
No surprises.
It is really important to take into consideration the financial impact that dental does take on a family. And I think we really get that. That's another thing experience teaches you.
Yes.
And
all
we-
the different insurance companies and all their coverage details. We understand that patients want to know, okay, but what does this mean for me?
Yeah.
Like I have some coverage
Because every
and
dollar
this is what you're
counts.
expecting.
Yeah.
Yes.
And you don't want to get a surprise.
Yes.
So that's why we definitely take that into consideration when we are putting things together for patients. And of course, clinic is deciding what is necessary we're not deciding based off of what's available to us with insurance, because it's important to decide what's right for the patient given the mouth. But on the back end of that, when you do come up to the administration team, then it is taken into
Financials
consideration.
count, yeah.
So you can make a decision whether or not it's covered or not covered, where the difference would be, because insurance can get tricky and it tricks us sometimes.
Yeah.
And it definitely can be
Well, there's
straightforward.
maximums, there's percentages, there's a number of units, there's everything. There's a family maximum, there's a person maximum.
Yeah. So taking that into consideration is important for families for sure.
We're happy that there's no surprises.
Yeah. No surprises.
No surprises. So what is it going to look like when your family arrives for their dental appointment?
Yeah, so that's a lot of what we've taken into consideration with the design of our new office. Parking in itself is a huge accomplishment. You're going to get a spot.
Woo!
You're not going to be fighting other people and fighting to get in and out. Beautiful parking lot.
It's quick and easy.
At the entrance, come up into a big, beautiful reception area where we have games for the kids or the adults. I've had adults ask me where they could purchase the game. They're having so much fun. I do love to, we say it all the time, the windows and the feeling like you're not in a dental office.
Yeah.
Like you look outside,
You're
you
still
can see
outside.
the trees.
Yeah.
And then because we have so many operatories, I love it when families come in and we can get everybody in at the same time. It's really easy for mom to communicate with all of, not only do we have so many, but they're situated close. So if you've got 4 kids in, you can see where all the 4 kids are and they can grab you easily. Our staff is also really good and situated nicely so they can help guide the parent.
And
then,
we find communication is key. So we make sure the parent comes in and goes to all the appointments, right?
Yeah. I love it when the parent leaves. I mean, I get it. I'd love to just drop my kids and leave as well for the break, but it is important for them to come in and chat with us.
Yeah.
But it's easy appointments. You know that you're going to get really great care for all 4 of those because we make sure that the quality is the same regardless of who you're seeing. And then same thing out the other side of it. You've got a team of administrators who are going to take into consideration that you want to move quick out the door. You do not want to stand there for 20 minutes sorting everybody's things out and what the insurance, that's already been pre-planned. It's a really easy sort. Our team is trying to get that together while the appointment is completing so that if you're, whether it's 1 of you or 5 of you, you can grab your paperwork. It's a quick and easy.
Jump in the car and you're on your way.
Yeah. I think most important when you're looking for a spot for your family dental practice, you're looking for a place that cares about what everybody's thinking and is taking into consideration, whether it's a child or an adult or a senior, how it feels. And we talk a lot about that. What does it feel like walking in? What does this appointment feel like? At what point did somebody get confused? We want to make sure that communication is really quick and easy. Our AI software and being able to show patients, because we get it. People want to understand what you're talking about. They don't want to just have to take instruction and not understand what's going on and say a blank yes. They want to see what you're meaning. And so we do take a lot of that into consideration with the AI, with the digital scanning, so that you're really informed and you feel like you're being well taken care of. And I think that's the most important thing. Like you're saying, as a family, we are a family. We know what it feels like. You want to know you're going somewhere where somebody's taking consideration. So that's really important, obviously.
Yeah. I don't want to go somewhere with my family that, you need certain treatment and you expect a certain level of treatment and you just can't get it there.
Yeah.
Like we know that we have the airflows. We know that we have the digital technology. We know that we have the expertise among the team that can help anyone with any situation and really treat their dental needs to the best of our abilities.
Yeah, and our team cares.
Yep.
Like they are worried when somebody's upset or it didn't go great, or, I love when the operatory needs help and there's like 6 people that show up to help. That's a good sign that everybody's kind of plugged in and taking care of what's happening.
I think we're doing a good job.
We're a good dental home. All right. Thanks, guys, for
thank you. Thank you for coming today. I don't know.
To the Fielding Dental Healthcare podcast.
Yeah. And we'll be back with more tips and tricks and dental needs.